clinical experience is their superpower because they have learned so many things beyond just what is the diagnosis and treatment. At med school and in your early years, that's what you worry about most because you've got to walk before you can run. But if you stop and think about it, you've learned about how to prioritize. You've learned about how to have difficult conversations. You've learned aspects of leadership because you've had to make decisions and show people. You've learned how to try and manage work-life balance. You've learned how to get on with difficult colleagues. You've learned so many things, but you never actually see it that way because you tell yourself you're just in a clinical job where you make a diagnosis and give treatment. One of the things I hate the most is when people say you've got a non-clinical job now, because that makes it sound black and white. Like, you are a clinician who is experienced and skilled to be a clinician, or you are the other, and the other is not clinical, no experience, nothing to offer, struggle street. And it's just not true. There are so many things that we do as doctors that bring our skills that are so transferable to other skill sets. And I think it's a mindset for us, particularly for doctors who might be choosing to use their skills in a different way, apart from making diagnosis and giving treatment. We have this frame of reference where it's bad, it's the dark side, it's different, it's shameful, and it's so not. And I think we have to flip it around and say, I have learned so much, of which a small part of it is diagnosis and treatment. And I'm going to go and use that in other skills, in other places. And I have this set of skills that nobody else will have without having come through medical training. So it is unique the way we bring those skills. And I think you just have to stop and think about what you do every day to realize that you can do so much more than just the diagnosis and treatment.